welcome to our continuing Texas 4000 speaker series. This is an opportunity to hear firsthand from doctors and cancer experts about a variety of topics. I am Ryan Logan, the 2021 Programs Chair, and today we are joined by Dr. Williams-Brown from Dell Medical School to hear about some topics in gynecologic cancer. Dr. Williams-Brown is an associate professor in the Department of Women's Health and a courtesy associate professor in the Department of Oncology. Thank you so much for being here with us today. We have really been looking forward to it. We're going to start today with a presentation from Dr. Williams-Brown, so the floor is yours whenever you're ready.
Thank you so much, Ryan. I really appreciate the opportunity to be able to speak for your group. And I wanted to talk a little bit today about cervical cancer screening and primary prevention. So we're going to go through a few of these slides. So I first wanted to just talk about some of the key points here, and the main things that I want you all to take away from this is that cervical cancer is a highly preventable cancer and it is curable if diagnosed in early stages. When cancer is caught in a much later stage, then it's much harder to cure and it's much more difficult for patients in terms of the types of treatments and the things that patients have to endure. It is also important to understand and know that populations that have barriers to screening or treatment for cervical cancer, those are the populations that are most vulnerable to higher rates of cervical cancer, and they're also found to have higher death rates. And we'll talk a little bit about some of those disparities that we see in certain populations. And then finally, I want you all to come away from this knowing that there is a way to actually prevent this type of cancer, and that's primarily through HPV vaccination. Not only is vaccination helpful for primary prevention, but screening is also important as well. But HPV vaccination not only can be helpful for prevention of cervical cancer, it can also be helpful for the prevention of other HPV-associated cancers. So the reason why HPV is so important in terms of its relationship to cervical cancer is because 99% of cervical cancers are associated with HPV. HPV is pretty much everywhere. It is the most common sexually transmitted infection in the US, and it doesn't always mean that it is passed through intercourse. Just through intimate skin-to-skin contact can be a way that HPV can be transmitted. And because many times this is something that can occur without any symptoms, a lot of people have HPV and they may not even know that. Approximately 1 in 4 people currently have at least one strain of HPV, and most HPV does clear without any treatment. But it's the people who have a persistent HPV infection are the ones that are most at risk for developing precancer and then later cancer. The important thing about HPV and cancer screening is that the screening for cervical cancer in the US has been extremely important in its role in reducing the mortality of women from the leading cause of death to now is like number 14. So we've seen that it's been extremely important for screening programs, their role in terms of being able to help reduce the morbidity and mortality of this deadly disease. So as I said earlier, most people have had exposure to HPV, and that typically occurs usually around the teenage years and the early 20s in terms of when most people are first exposed to HPV. And that will quickly decline because, again, many people will have HPV infections, but they will clear just with your normal immune system function. But then for some people, and there are certain risk factors such as smoking or having immunocompromised status or other conditions that would cause an integration of that virus into a host cell, those are the things that are precursors to developing things like precancer and then eventually the development of cancer. As we see here in this map, there is a very different distribution in terms of which populations are affected by cervical cancer. And we see that in the dark blue places on the world map here, these are areas where there are higher incidences, and nearly 85% of the world's cases occur in Eastern and Middle Africa. And the reason why we see places that have higher cervical cancer screening or higher cervical cancer rates than others really points to access to cervical cancer screening and also treatment. But the disparities in terms of who and where cervical cancer is found is not just worldwide. We can also see the differences in terms of different racial and ethnic groups here in the United States in terms of how who has cervical cancer. So in the US, Black women and those in lower socioeconomic groups have the highest age-adjusted cervical cancer death rates, and Hispanic women have the highest incidence rates. And many times we see that the differences have a lot to do with access to screening programs, as well as socioeconomic differences in these populations. And so when we think about just in general, who or how do we screen for cervical cancer, the beginning of cervical cancer screening should start at 21. And that is regardless of whether or not a person has initiated sexual intercourse or not. And the reason why that is that sometimes there could be situations where a person may not feel comfortable disclosing any contact. It could have been non-consensual, or perhaps it's just not something that culturally or personally someone may be comfortable in sharing. So the recommendation is, not putting any stipulation of how many years past sexual contact to start screening. The recommendation is to start screening at age 21. And depending on the age range, either it can be a Pap test, which is just a collection of cells at the cervix and the vagina, or also incorporating the DNA test of the HPV virus to detect the presence of the virus there. So the combination of those of the HPV test along with cytology can be used depending on what the person's age range is. And there are some situations where you can actually just do high-risk HPV testing alone. So in terms of ways that you can prevent HPV related cancers, and specifically also cervical cancer, it's recommended for children age 11 to 12, really is what the CDC guidelines are in terms of who should or when vaccination should occur. But it's also important that people can get these vaccines all the way up to 26. So I think there's actually an error here in terms of boys and girls from all the way up to 26 should be eligible to have HPV vaccinations, and boys and girls all the way as low as 9 years old can receive the vaccine, but children age 11 and 12, that's the usual age range to recommend having HPV vaccines, because it can also be coupled with other age-related vaccines that are given at that time. And what's also important too is that HPV can be implicated or a cause for other types of cancers, such as vulvar and vaginal cancers in females, and also anal and oropharyngeal cancers in females and males. And in males, there's also penile cancer. So it's not only important in preventing cervical cancer in terms of the HPV vaccine, is very important in terms of general cancer prevention that can be associated with HPV. And so with that, I'm happy to take any questions.
Thank you so much for that presentation. It was truly insightful. Now we'll transition to a quick Q&A session with some other members of our programs team.
Hi, first of all, I just wanted to thank you for that presentation. It was extremely insightful. I think I learned a lot, and I think the people watching this are going to learn a lot from it. So I kind of wanted to start by asking you about risk factors of cervical cancer aside from HPV? So are there any environmental or epigenetic factors that might contribute to cervical cancer?
So because HPV is 99% associated with the development of cervical cancer, the things that really are like, in terms of risk factors, are those things that can really expose someone to HPV infection or prevent someone from clearing it. So things like, having immunocompromised status because your body's not able to clear that, or having exposure to sexual activity early could be a risk factor, or potentially having other sexually transmitted infections can be risk. Other things such as smoking is a huge risk factor in terms of the ability of your immune system to be able to clear things. So those are definitely things that are risk factors. And lack of screening is also a huge one, just because, many times, even if that virus is detected, it can be, the pre-cancerous conditions can be treated before it turns to cancer. So not having screening or lack of screening is certainly one of the modifiable risk factors.
Thank you.
Hi, my name is Addison. I also wanted to thank you for the presentation. I learned a lot from it. And I just was wondering if there are any symptoms of cervical or other gynecologic cancers that people should be aware of.
That's a great question. So many times, because we have done such a pretty good job in the United States of being able to screen for these cancers, many times women may not actually have any symptoms, and they may be found only through abnormal screening. But for some women who may not have adequate screening or any screening at all, they may present when they have abnormal bleeding. So they may have bleeding in between their periods, or having heavier menstrual bleeding, or bleeding after intercourse. Also, for women who've already stopped having periods, that could also be an indication if they start having bleeding again after menopause. Other things that could be signs of cervical cancer are pain during intercourse, or just having pelvic pain in general.
Hi, what does treatment for cervical cancer look like, and what is the general prognosis for people diagnosed with cervical cancer?
That's great. Yeah. So having diagnosed, if a person is diagnosed with cervical cancer early, there are different options for treatment, some of which could be involving just removing a part of the cervix and assessing things like lymph nodes. But it could also involve a removal of the entire cervix and part of the vagina and lymph nodes and the uterus. And in later stages, it could involve having treatment with radiation and chemotherapy. Sometimes patients that have more advanced disease will get treated with just chemotherapy. And there are some treatments such as immunotherapy, which is used in advanced or recurrent stages. In terms of the outlook of treatment, when cancer is caught early and in very early stages, the chance of cure is very good. So it's over 90% for very early stage cervical cancer, which really highlights the need for detecting these cancers before they turn to in early stages, or even before they're cancer. So we can catch these things when they're in the pre-cancer state. But for patients that have advanced or metastasized cancers, unfortunately, their outlook is much poorer, and their 5-year survival rate is somewhere around 17% for advanced stages.
Thank you.
Another question I had was kind of about, how we talked about earlier, the barriers to healthcare, and how that is most likely one of the big risk factors for cervical cancer, because, if you can't access healthcare, you might not get screenings, things like that. With regards to the HPV vaccine specifically, are there low-cost options to receive the HPV vaccine? And if so, how can people find them?
So there is a adolescent vaccine programs, or a vaccine program for children. So people who are under the age of 18, there are ways to be able to get this vaccine at low or no cost. Unfortunately, for people who are adults, and as mentioned earlier, an HPV vaccine is something that can be received, is recommended up to 26, but actually is now FDA approved up to 45. So, but the problem with that is many times that may not be covered, at least if someone doesn't have an insurance program, for instance. So many insurance programs will cover these vaccines up to 26, and in some cases to 45. But if someone is uninsured or does not have a way to obtain these through other programs, such as the Vaccine for Children program, it may be difficult to get, which is unfortunate.
Thank you.
Hi, I had a question kind of just regarding how healthcare has shifted with COVID, and how has telemedicine affected the diagnosis and treatment of cervical cancer?
So, I think just like many other diseases outside of cervical cancer, many times people were very afraid to come in for their routine health checkups. And cervical cancer screening is a routine part of many well-woman exams. And so because of that, I think there was a decrease in people obtaining these checkups. Fortunately, cervical cancer is not something that happens overnight. And so if someone happened to miss their cervical cancer screening visit last year, it doesn't mean that having it this year is terrible, but because it takes years a lot of times for these cancers to develop. But I certainly believe that when people miss the opportunity to participate in screening programs, those are opportunities that they're missing to be able to catch and diseases that can be prevented earlier, or either treated at an earlier stage if it is cancer.
All right, one last question from me. How do you feel about the outlook of cervical cancer moving forward? Do you feel optimistic that it will continue to fall as one of the bigger cancers?
So I am optimistic, and I'm mostly optimistic because of the impact of HPV vaccines. So just like the Pap smear and then later the HPV test dramatically affected the incidence and the death rates of cervical cancer in the United States, I think with more and more uptake of the HPV vaccine, we will start to see the decrease in precancers and then eventually cervical cancers in the population. And in some places, such as Australia, where they have a very high uptake in the HPV vaccines, they're already starting to see some of those effects, like the decrease in precancers in their population. So I am really hopeful that as time goes on and as more people are accepting of these vaccines, that we will see in the next 10, 15, 20 years, which is the lifetime, usually the time frame of what it takes in terms of these viruses to actually cause cancer, that we'll see a decrease in these cancers overall, hopefully before the end of my career.
Certainly. All right, well, I think that just about wraps up all the questions we had. On behalf of all of Texas 4000, thank you so much for making the time for us and sharing all that vital information. We truly enjoyed it, and we wish you the best of luck moving forward.
Great. Thank you so much for having me.